So yes, sometimes learning new things. Yes, this show might make you blush. Yes, hearing me, you might cringe at some of the things that I'm saying. And you might think, oh, how could she say that? Or, whatever it is. But like the more you listen and the more you understand that this is a natural part of all of us, it's okay to talk about it. We're not anomalies, the three of us just talking about this. We're here because we want to help people have more fulfilling lives. Sexuality is part of that fulfillment.
Hello, and welcome to the Art of Living Well podcast. I'm Stephanie May Potter, and I'm here with my co-host, Marnie Dotches-Marmette.
We created the Art of Living Well podcast to empower you to live your happiest, healthiest, and most authentic life. Each week, we will bring you inspiring and motivating conversations covering health and wellness topics, including fitness, mindset, food, travel, product reviews, and strategies from a variety of experts, including our own bank of knowledge.
We are excited to educate, motivate, and inspire you to change the way you perceive health and discover your art of living well. Get ready to feel inspired.
Hello, and welcome to episode 122 of the Art of Living Well podcast. Thank you so much for tuning in today. And before we dive into the episode, we are so excited to share our new podcast episode format that we will be dropping monthly. It's called a 15-minute health transformation audit. And we will be bringing you, our community members, on our show for a 15-minute health transformation audit where we will guide you to identify what's holding you back from your ideal health and wellness. And we'll analyze together with you, and then you can walk away with a tangible action step. We are so excited about these mini episodes. As integrative health practitioners and health coaches, we love doing this kind of work with you. So grab a cup of tea, get cozy. Check out last week's episode 121 to hear from our community member, Kim. Even better, we would love to have you on. So email theartoflivingwellpodcast@gmail.com and let us know you'd like to sign up for your 15-minute health transformation audit. And now let's welcome today's guest, Dr. Laurie Betito. Dr. Laurie is a clinical psychologist with a specialty in sexual wellness, and she has been a practicing psychotherapist for over 30 years. For the last 3 decades, she has been on radio and television dispensing sex and relationship advice. For 22 years, she was the host of the nightly Canadian syndicated show Passion, and she is a regular contributor to various magazines, newspapers, and television shows. She is also the president of the Sexual Health Network of Quebec and the past president of the Canadian Sex Research Forum. Dr. Laurie is the author of The Sex Bible for People Over 50. She is also the director of the Pornhub Sexual Wellness Center, an online sexual health information platform. Dr. Laurie has done 2 TEDx talks on the subject of sexuality, and she hosts a weekly podcast, Passion with Dr. Laurie and Jon Pole, and it is available on all platforms. In today's episode, we talk about why sex is a taboo topic, what are the benefits of having a healthy and vibrant sex life. We talk about issues that people have with sex and even some of the common myths about sex and aging and what types of things need to change both biologically and emotionally for people. We talked about couples who have been together a long time and who have potentially lost that spark or passion in the bedroom and what are some techniques they can use to reconnect with their partner. And then as parents, we talk about our teens and what they can do to have a healthy sex life and to monitor what they see on social media and even to how do you have these kinds of conversations with your teens. Dr. Laurie incorporates so much fantastic knowledge into this episode, and she leaves us with so many simple and practical tips that we can implement immediately into our lives. So we are so excited to dive right in with Dr. Laurie Betito.
But first, a quick word from our sponsor, Thrive Chiropractic. I was first introduced to Thrive Chiropractic over 5 years ago for kinesiology-based food sensitivity testing. I was so amazed by this non-invasive and inexpensive technique that I took my son to have testing done, which confirmed some of his food sensitivities. Both my son and I now have regular tune-ups, and even my leery husband has felt the immense benefits from receiving chiropractic care, including cupping.
With over 25 years of clinical experience, the doctors at Thrive Chiropractic, located in Minnetonka, Minnesota, combine their passion for wellness with a strong expertise in effective treatment approaches. When you first come to Thrive Chiropractic, the doctors are focused on helping you feel better as soon as possible, and they recognize that one type of treatment or technique does not work for everyone. Your comprehensive exam, personal goals, and individual concerns help the doctors tailor your custom treatment plan for maximum results. Thrive Chiropractic's integrative approach offers holistic and effective healthcare with a full spectrum of complementary products and services, including acupuncture, massage, food sensitivity testing, CBD, and premium supplements.
As a special offer, Thrive Chiropractic would like to invite listeners of our podcast to experience the gift of health with a $25 new patient visit, which includes the initial consultation, a comprehensive exam, any necessary x-rays, and first adjustments. Simply visit the website at www.thrivechiromn.com or call 952-746-5612 and reference the Art of Living Well podcast. When you're seeking effective, non-invasive treatment approaches to support your health goals, let Thrive Chiropractic be your partner in wellness. Call or book online today.
Hi, Dr. Laurie. We are both really excited to have you on our podcast, as we've been wanting to have a sex therapist on our show for quite some time now. And Marty and I both first heard you on another podcast, and we immediately reached out and knew you'd be a great fit for our audience. So thank you so much for coming on our show today.
I'm very happy to share anything, answer questions, whatever it is. It's been my mission my whole career, just to, get people to have healthy sexuality. And so whatever helps is good.
Great. Well, we know everyone has a story, and we would love to just hear your journey of how you became a psychologist specializing in sexual wellness, and really diving into this work for the past 30 years.
Yeah, it's been a long road, long, fun road. It's a really great topic to focus on. So, I got to my PhD and it kind of didn't go straight there. I ended up doing like 4 other degrees before that, but always within the helping profession. And sometime during an undergrad, I met a teacher, and this was at McGill University, and she was basically teaching the only course in sexuality that existed at the university at the time. So you're talking like many years ago, 35 years ago, and this ages me, but yes. And I was so enthralled, like it was such a fascinating, like I was always interested in behavior, but sexual behavior became even more fascinating to me. And so I just kind of followed her route. Like, she had mentored with a specific person, and I went and met with him, and I started doing training and what have you. So within all my other graduate degrees and what have you, I also did this additional 2-year training program. But people often ask, like, when did you want to do this? And it's, as you get older, your memory gets worse, so you kind of forget. But one time, I don't remember how many years ago it was, I ran into a high school teacher of mine, and she said to me, this is 20 years later or whatever, said to me, "Hey, did you ever become the sex therapist you said you wanted to be?" And I said, "Did I talk about that when I was 15, 16? She says, "You did." And I was, "What?" So that was like a big, I was like, okay. So then I started piecing together. It's true. When I was like in grade 10, grade 11, my friends would come to ask me questions about sexuality, not because I was particularly like knowledgeable, but I was able to talk about it. I have a big mouth, and I guess I don't have much shyness around me. So it was like an easy thing. And if I didn't know the answer, I said, "I'll go look, I'll find it for you," And of course, but back then I had access to very little information. We didn't have the internet. So my biggest source of information was Cosmopolitan magazine. Every issue had like how to give a great blowjob or how to, and that was it. So that, and I had encyclopedia. So I could do the biology and I could do the, that was about it. Didn't have anything else. So I guess it evolved from there. I think it was a topic that just I was very open about, which is interesting because I wasn't necessarily raised in a household that, I had immigrant parents. We didn't talk about sex, but I was a bit rebellious in the sense that I would push the envelope a lot. So this was me pushing the envelope, like talking about a taboo subject, so it just was something that was easier for me. And then I got into almost immediately into my career, got into radio and media very, very soon. And that became my career. It wasn't where I expected it to go or where I was driven to go, but it's where I landed. And that was I was working at a clinic, a sexual dysfunction clinic where I trained. And, in walks this guy from a radio station who says, hey, we want to do a show about sexuality. Anybody here interested? And we were a few sex therapists there. And I said, yeah, sure. I was young, whatever. I said, if it blows, it blows, and I'll never do it again. And I ended up doing that particular show, became huge, had a huge following in Montreal. And I did that for like 9 years. And then it was like a weekly show. And then that same guy who initially started the show was transferred to another radio station. They invited me to do a nightly show on the air. And so I did 22 years of nightly sex.
Wow.
Yeah.
So you've heard it all.
I've heard it all. I've done about 5,000 to 6,000 episodes. 1 hour nightly show. Didn't get much sleep for many, many years. But anyway, that was then. And then when that ended, I moved over into podcasting. And so through that, I've done television, radio, print. So it's really been about educating the public and talking about sexuality in such a way that just makes it much more accessible, even if it is from a science-based, evidence-based position. And, I have a private practice as well. So I'm a clinical psychologist. I focus on marriage counseling, marriage therapy, individual therapy, sexual dysfunction. I mean, all kinds of stuff, but I like to focus on the sexuality stuff. That's what most people seek me out for anyway. So, and here I am, just,
Amazing. Well, we have so many questions for you. So many questions.
Anything you want, throw it my way.
Before we dive in, why do you think sex and pleasure is such a taboo topic? And how can we change that or address that?
I wish I knew. I wish I knew why it was so damn taboo, considering we are all sexual. Every human being, whether they choose to have sex or not, doesn't change the fact that we are all sexual beings. We all have body parts that bring us pleasure. And yet it starts very young. If you think about it, when you're playing with your little babies, your 1-year-olds, and you're going, show me your nose, show me your elbow. When do you ever say, show me your penis, show me your testicles, show me your clitoris, But why? Why? They're in the bath. Like, why are you avoiding those body parts? So from a very young age, we're already taught, we don't even say those words. We don't even, and when we do address it, we say, oh, look at your little flower, and oh, look at your little winkle or whatever it is, like, why aren't we using proper terminology?
Oh.
So it starts there. That's where it begins. And then, of course, as your kids get older, it gets even more uncomfortable to really talk about it. But it's the climate at home where there is no talk about sexuality. So by not talking, you've made it a taboo, right? It's what you don't do also. It's not what you do, but what you don't do. So, a good example is when so I have two kids. They're grown now, but somebody asked my daughter once, oh, when did you learn about sex? And she had such a great answer. She said, she thought about it for a minute and she says, I've always known. Like, there is no one moment. I've always known. It's like, It's just been part of the family conversations and, using proper terminology. my kids knew about pleasure and, like I remember, at 2 years old, like, oh, when, my daughter's in the bath, she goes, oh, that feels good. It's my tickle spot or something. I said, yeah, that's called your clitoris and it's there to make you feel good. So, touch it whenever you want. It's okay. And it just, it was just nonchalant. So when we make it like such a, mommy turns red when the word, clitoris comes up or vulva or whatever. Well, you think your kids aren't picking up on that? So we need to practice together as adults, talking about this in an open manner so that we transmit this as a normal part of life. And we're able to talk about this. And then, of course, we talk about privacy and why, like, we don't want to just be bad. We want, like, yes, of course it's good and whatever, but it has a context, and here's the context, and here's how we protect you, and here's how you have to protect yourself. And if you look at the research, the children whose parents don't talk to them about sexuality are at much higher risk for exploitation. So it's a protective thing by talking about them. It's not, if I talk about it, it means you're going to go do it. Like, that's just a myth. And that is not the case, And
I think that's like such an old school way of thinking about it. I think that's how a lot of us were probably raised. So I'm glad that you're here sharing the message. Do you see a difference? Like, you're in Montreal, in different parts of the world, as far as like different countries having, maybe being a little bit more open or progressive in that way, where they're having those conversations earlier?
Well, definitely there's huge differences from wherever you come from in the world. So part of my work has also been, I joined forces with a big porn company where I established a sexual wellness, like an educational site on their porn site, so that people who were watching had a place to go for real information, evidence-based information. And there's a Q&A section there that people can respond to. So I see the questions that come from all over the world there. And I can see where people have zero education. The only education they get is through porn. And I'm like, this is really sad, right? Like, which is one of the reasons why I did that, so that I have access to people who wouldn't normally have access to sexual wellness information. So yes, in different parts of the world, you're going to have different access to education. And of course, if you're in the States, for example, where you have abstinence-based education, you're unlikely to get parents who are going to talk openly about sexuality when they demand their schools not to even talk about sexuality. But that's also where you have the highest rates of teen pregnancy, the highest rates of sexually transmitted infections, the highest rates of pornography use in those repressive environments. So how does that help anybody, right? It's and we already know, if you look at the evidence, that abstinence-based education doesn't work to prevent any of that, but comprehensive sex education does. I'm fortunate. I live in a country where we have much more of that, and some provinces better than others and do it better. It's not perfect, but we have a little bit more of an openness to making sure it's part of the curriculum and that we do discuss it. But I'm also very well aware that there are other countries that do it better. I'm thinking of the Netherlands or Sweden, and they have amazing educational programs. So we have a lot to learn. Like, there's a lot, and we can't, it's been politicized, which it's part of life. Like, why should this be something that it's health? Like, it shouldn't be part of that. Everybody should learn. It doesn't mean you're giving them permission. I think we have to get away from that notion. Here's the information. Look, make good decisions. We can teach people how to make good decisions, get them to think critically, but just telling somebody don't do it, know that, this is dangerous. We know children's minds. We know teenagers. Do they listen? They don't listen. They're driven by something else. Their prefrontal cortex isn't well developed until they're well into their 20s. So, they're going to make stupid decisions. Better to arm them with information, if you ask me.
So while we're on the topic of teenagers, Stephanie and I both have teenagers. We both have sons and daughters. Uh-huh. And I think that these kids today learn a lot from social media and TikTok, and I'm sure there's some porn happening. I kind of don't want to know about it, but I'm sure it's happening.
Yeah.
But then I worry, I try and talk to my daughters and they're like, we know, Mom, we know everything. You don't need to tell us. Like, we know. And it's like, I don't know how to open the door and have these healthy conversations when they're like, no, we don't want to talk to you about this.
So that's a good point, right? So when you talk at a young age with kids about this, it's, if you start talking to them when they're already teenagers, they're like, I don't want to hear it. Like, that's, we already know, don't worry, but you don't know what they know. That's the reality. So some of the best things to do is finding teachable moments or bringing up scenarios with them and getting their opinion. So treating them like you would, I'm curious to know what you think about this. Hey, I heard about this girl that gave birth at 16, or I don't know, whatever story you want to make up. But what do you think about that? How do you think she handled it or could handle it? What do you think you would do in a situation like that? Like, if you bring up another, not about them, don't ask them, what are you doing? Are you having sex with your boyfriend? They're like, stop, don't forget to use condoms. Like, no, you want to see how they think about this, right? You want them to open up how they think. So they may not be talking about themselves, but you get a very good idea of what's happening around them and their influences. Find out, like, when you're watching a show with them, there's so many stupid reality TV shows, but it may hurt you to watch them. But if that's what they're watching, watch it and then use one of those examples and say, what do you think about that? What do you think about all these filters being used, or what do you think about whatever it is? And it's a really great way. I used to love having conversations in the car because they were trapped, and it was a good place to start.
Well, and one of the things that I not worry about, but like, yes, my kids know about, like you said, diseases and contraception and, being leery of strangers and all, frat parties and all of that kind of stuff. But like, what about, especially for the teenage girls, knowing that they want to make sure they're comfortable and they're being sexually pleasured if they're in fact in some sort of sexual relationship, and that it's not just about pleasing the other person, right? Or, how do you raise children and teenagers to know that? Because I feel like our society is so much not about that.
Well, as somebody who has daughters myself, it was really important for me to empower them to make decisions for themselves. You do what feels good for you, right? So girls today will choose to have sex because they want to have sex, because it feels good for them, but we still slut shame them, right? Like, girls are still in this position. There's still a double standard that if they choose sex, somehow it's not okay. But if the guy chooses sex, well, that's okay. Right. And we have to start moving away from that. So empowering them to say, you can choose when, how, what, where, that's your body, your choice. Teaching them what healthy relationships are all about as well. You can give them examples and say, do you think this is healthy? Is that healthy? Like, how would you handle a partner that tells you, I'm jealous because I love you and I don't want you to see any friends, or I forbid you to have friends that are guys? How would you handle a situation like that? Right. So, and then you'll get to see how they think, and you can have a conversation about that. But sometimes there's a fear, like, of empowering girls, because, we all hope they, keep them virginal. Like, we don't want them to, get involved, but that's unrealistic. And for me, what was important was, if you're going to have sex, which I'm assuming you will, considering statistically most people have sex around the age of 17. So I'll just assume, I'm not asking you directly, I'm just assuming, then what's important is that you understand that you shouldn't be experiencing pain on a regular basis. It should feel good. So if it doesn't feel good, something's up. Let's talk about, then please, come to me or talk to your doctor, or we'll figure this out. But you don't need to, pain shouldn't be suffering shouldn't be part of sex. It should feel good. And so that kind of lets them know that yeah, of course there should be pleasure for you. Like, why else, it should be pleasurable for you. And if it's not, we need to look at why.
Yes. And that's such a good question. I'm glad Marnie asked it, because I'm in a very similar situation where they just say they know everything. And these are such good examples, like real life situations that you can, start to have that dialogue. And I love the car example, like that. And it's usually like a short trip, right? So you don't have that much time with them, and it just starts the conversation and gets them thinking. But I think too, kind of thinking back to my teenage years, there's also pressure on girls just to do it because they feel pressure like they should and not enjoy it. And you're doing it for the guy. You're not doing it for yourself. I'm just speaking of girls, and I'm sure it goes both ways too. So again, that empowerment is just so important, and really to understand why you're doing it,
And the issue of consent, right? These days, we have to talk about what consent is. And consent is in submission, like somebody pressuring you and you saying yes is not consent, right? So we have to talk about what's enthusiastic consent. That's the important thing. So, and having these conversations with our kids is really important. But the topic of consent comes up when they're 4 or 5 years old. And it's not about sexual consent. It's about, you can't take somebody else's toy. You have to ask, like you start talking about what consent actually is in many different contexts. So when the time comes, when it comes to sexual consent, now we talk about how one consents, what consent isn't, and if you're drunk, can you consent, and what's legal and what's not, and how you can get in trouble, and how everybody should be very much aware of what's going on if you're going to have a healthy experience and not have regrets, right? Because you want to minimize your regretful sexual experiences, obviously.
Yeah, and it does sometimes feel like teenage girls are in a no-win situation. It's like,
and
you're damned if you do, damned if you don't.
Well, but it's interesting because I hear from guys too, the pressure, right?
Mm-hmm.
Like, what about guys who don't want to, and guys who feel like they want to get consent, but then feel like they're less of a man because they're not taking charge, so it's very confusing for both. It's confusing for men too, as to what I do. Like, what we see in the media is a slice of young men, the college stories and what have you. But is that your average guy? I don't think so. And I think if we're raising boys right, which we need to be doing more of, and not just letting them, it's okay, they're boys will be boys. Can't have that attitude. We have to teach boys how to treat girls, and we have to teach girls how to treat men too, and also how to be respectful of themselves and feel like they have control over themselves.
Yeah, absolutely. So love this conversation about teens, but we also want to kind of pivot and talk about people our generation a little bit.
There's so much to talk about, right? I mean, we could go on for hours and hours and hours.
We totally could.
I know. I mean, let's just start out. Like, what are some of the common issues that you see couples for?
The most common issue that I see is desire discrepancy issues. So where one wants it a lot more than the other. So when those people show up in the office, my job is to evaluate, well, what's happening here, right? Where is this coming from? Why is this going on? Is this a physical issue? Is this a relationship issue? Is this simply just one person who just doesn't have the same, just not the same, which is normal. Like, why should you be the same? But then a lot of the work I do is education based in terms of understanding also the differences between men and women and how they experience desires. So I actually did a TED talk on the subject. It's about sex in long-term relationships, just to explain, and also female sexuality. So how that can evolve for women. I'm talking generally now. So this isn't true of every woman, right, every man. So please understand, but this is what I see most often. It's not that women lose the desire per se to have sex, but they might lose the horniness. They might lose the spontaneous desire. But if you ask those same women, well, when you have sex with your partner, do you enjoy it? They most often they say, yeah, it's great. Like, love it. It's great. We have fun. It's wonderful. They just don't have the oomph to, just to get there. Right. And, think of life and how it is. And women tend to have much more on their minds, and it's much more difficult for them to separate out the everyday stresses and anxieties and worries and all of these things to put it on the back burner and just enjoy the moment having sex. It's a little bit like, I don't know if you've ever had a massage. You go sit on the massage table. How often do you actually just feel the massage? You probably are like, what? It's done? What already? Why? Because your mind has been wandering the whole time. You're not actually appreciating and enjoying the moment, because we do have a bit of a harder time doing that. So the key here is that you may not have spontaneous desire for sex, meaning it's not just a throbbing in your clitoris suddenly that says, ooh, I want to have sex right now. But you are responsive. In other words, your desire is responsive, which means that if the conditions are right, meaning you're in a relaxed state and you decide you're going to have sex and your partner starts to stimulate you, that stimulation should trigger your desire, which means your desire has become responsive. But it needs something, right? It's like a car that's in neutral. It needs an action to get it into drive. And think about, guys are always in drive for the most part. Not some guys are in the reverse situation as well. Sometimes we see the reverse, but they're always in drive, which means it doesn't take all that much to kind of get it going, right? But women are in neutral. And oftentimes, though, women come thinking they're dead, or their partners say, something wrong with my wife, fix her, And it's like, oh, she's not dead, she's not dead. Like, you just have to know how to get her going. And then part of it too is examining what's holding her back from choosing sex. So choosing to be with a partner, because what drives us may not be horny, but closeness, right? I want to be close to my partner. It's so nice. It feels so good. I want to feel that intimacy. And of course, I know there's pleasure with it and all of these things. But if your relationship is problematic for whatever, if there's resentments between you, if there's anger, if there's all kinds of stuff, are you actually going to choose to want to be close with your partner? So you need to have some warmth in your heart to put yourself into that situation. So in therapy, we kind of figure out, okay, what are the roadblocks? Are some of these roadblocks relationship issues? Sometimes they are. Sometimes I hear complaints from women like, I feel like my husband is like a third child at home. And, if you perceive your husband to be a child, you're not going to be attracted to him. Like it's a blockage, right? You're not going to be attracted to your own child. So, and that's what it feels like. So it can feel like that, and you start to lose that attraction. So there's things that have to be done to kind of fix that situation. And, sometimes guys don't quite get it, because for them, it feels like a hunger. So they don't understand why you're not hungry. So they think there's something wrong with you, because I'm always hungry. Why aren't you hungry? They just don't understand that that your hunger needs to be stimulated. I often give the example of going to a restaurant. If you're hungry, you're the one who's going to be suggesting, let's go out to eat. So the person who's not hungry is not generally going to suggest it. So the other person is going to say, okay, I'll join you. Like I'll go with you. I may not eat, but I'll go with you. And then you are at the restaurant and your partner orders a really nice steak and you smell it and you're, that looks really good. Can I have a bite? And then you get a bite and then you're like, oh, you know what? I'm going to get my own. And then suddenly now you're both enjoying a meal, right? So your meal was like your hunger was stimulated by the odors, by the taste, by all of this stuff. So it's a little bit the same in sex. You need to be stimulated to open up that hunger and that desire. I don't know if that makes sense to you guys, but
yeah, no, it does.
Yes.
It does. So from what you're saying, if older, not even older, but let's say a couple is having some trouble in the bedroom and the man wants more than the woman, or the woman wants more than the man, whatever, it's probably the reverse more often.
Uh-huh.
What are some techniques or suggestions you make for people to kind of reconnect with their partner?
Well, part of it is the first understanding what is it that your partner needs, right? So the person we know what the high sex drive person wants. They want sex. But for you to get sex, you have to give your partner what she wants. And maybe what she wants is affection that doesn't lead to sex. Maybe I just want you to touch me in a loving, tender way. Instead of, when you come and give me a hug, you're not just grabbing my breasts. You're not just squeezing my ass. It's not a sexual touch. It's a loving touch. Maybe that's what I need a little bit more of. Maybe I need you to show me that you care about how fatigued I am and you want to help me because you want me to rest and you want me to feel good, So these are you have to find out what it is that I need more of. Maybe I need you to not be so critical of me and not yell at me, every day, because it takes me a few days to recover every time you do this. And when you do this, I'm not interested in having sex with you. I'm angry, I'm upset, I'm this, I'm that. So this is why we need to understand the dynamics of that couple. But if everything is good, like in many cases, I hear people say, we have a great relationship, we love each other, we're best friends, it's all good. Well, what's not happening is you're not putting sex on the table. Like you have to put it on your radar. You can't just wait, expect it to show up like an uninvited guest or invited, you've got to invite it in. So part of that is, I know people cringe when I say this, but yes, you have to schedule it. And whether
I was just going to ask you that.
Yeah, you have to. And whether you schedule it in your agenda and don't tell your partner, that's fine. Like if your partner resists it, why don't you just schedule it? But when you schedule it, you're preparing your environment. You're making sure you don't have a bunch of stuff to do before. You're making sure that it's going to be a relaxing, evening or morning or lunch or whatever you decide. Like you're planning it so that you're prepping the environment for you, because this is what you need, right? It's not as simple as pull down your pants, let's go, let's do it. It's all good. Like you can't shut down the rest of it that quickly. So you need to, if you plan it, you get a chance to shut it all down to be able to really appreciate the moment that you're in. And I'm not saying like spontaneous sex is great too, but it doesn't, may not happen as often as it once was. You once did it because now you have kids, mortgage, family, work, You have to find all the balance with all of that. Whereas when you were dating, you walk through the door and it was like, let's do it. There's all this excitement. But, once you fast forward into a long-term relationship, sorry, but that feeling kind of goes, out the window a little bit, unless you revive it, unless you create the passion, unless you put effort into making it a little more exciting and spicy and what have you. So we have to put the effort into it.
I'm wondering how often, and I know I'm sure there's a range, but how often would you say a healthy couple engages in sex? Yeah.
That's a great question. And luckily there's research that backs this one up. So that's a good thing. So there was research that was done that measured couples' happiness levels with the amount of sex that they had, right? And what they found was that couples who had sex less than once a week were less happy than couples who had sex more than once a week. But couples who had sex once a week or more had the same level of happiness. In other words, so once a week seems to be kind of the sweet spot. So, more than that didn't seem to change their happiness levels, but less than that did. So as a therapist, I always aim for the once a week. Of course, I get clients who, they say it's been months since they've had sex. Like it's not just, it's not just they have it once or twice a week, but now they want it 4 times a week. It's rare that's the case. But, it's about connecting. It's not just about the sex. It's about how else do you connect outside of the bedroom? And because ultimately, if your partner feels like they don't feel loved except in the bedroom, then they're going to want more sex. But if they feel, because there's many ways you could feel desired or show desire to your partner. It's like telling your partner, you know what, it'd be great to have sex, but I'm just too tired. But you're expressing this need, this want. It's not necessarily a need, but it's a want. Like, I would so do you right now, but I can't move, So, and there's research to show that actually has an effect, that actually makes the other person feel good. And so maybe not as, after the sexuality, because ultimately this is what I see. People want to feel desired. People want to feel wanted. People want to feel loved. We all do. That's a universal thing. So if some people get that through sex because they may not get it through other means, well, maybe we need to adjust in other areas. So being able to be affectionate and close and use loving words and be really loving towards your partner makes a huge difference. And I can tell you that as people get older, and I see a switch in men too, as men get older, it's not about frequency as much as it is about wanting that deep connection. So they become more, we join up at some point where we both want the intimacy more than we want the sex. Even though the sex is great, the intimacy matters. So tough it out until you're in your 50s, and then you'll maybe 60s, then you'll get that,
So what are your thoughts on sex toys?
I think they're great. I think sex toys they're great if it's what you want to explore. Some people use them, some people don't. A lot of people use them though. And I think sex toys in couples is a great idea. So I wrote a book called The Sex Bible for People Over 50, in which there is a chapter on sex toys, because as you get older, you need more stimulation to get to the same place. So the clitoris the feelings in our bodies change. There's lots of changes that happen. We can have an entire other show on just those changes, but sex toys help kind of get you to the same place maybe faster. Your partner is also aging, so maybe his hands aren't moving as fast as you need them to, or as hard, or whatever. So that the sex toys are a nice addition to it. And I don't know why anybody would have a problem with sex toys at all. Like, it's just a sexual aid, just help. It makes it better, or sometimes yes, sometimes it's all you need, So definitely encourage sex toys if it helps you keep going. And the whole use it or lose it thing does, there is some truth to that too. You want to keep the blood flowing going to your genitals to keep them healthy. So it's one way of taking care of your vagina is to keep that blood flow going. So even if you're not having sex with your partner, have sex with yourself. Like, just get that blood flow going. And same thing for men.
So going deeper into that, so what are like the benefits of having a healthy and vibrant sex life, kind of to what you're saying with the blood flow, but just in general, like other aspects of your life? Or
well, there's lots of research on that. Probably I think the first chapter of my book talks about all the benefits. There's no downside to it. There's only benefits to it. So we know that people who have regular sex live longer, look younger, have better immune systems, have more satisfying relationships, have better cardio health, have better blood pressure, less chance of stroke, there's all kinds of benefits to remember. What is sex? What does it do? It increases the blood flow. It gets your heart rate going. It's a form of exercise. Like, it's all good things, right? It connects people. I'm talking about sex within a certain context, obviously. So there's no bad reasons for sex. There's really only good reasons for sex.
Which no one really talks about. I mean, they talk about it in this space, but to kind of go back to our earlier conversation, no one's having a conversation. And it's funny when you said immune systems, because Marnie and I are leading a workshop like in 2 hours after we record this on boosting your immunity.
So
and we do have exercise.
Sex.
We're going to have to put sex in there now.
Yes, you are. Yes, you are.
And lots of sex, and you won't get COVID. I'm just kidding.
Look at the research, though. There is definitely there's definitely proof that this does help, because ultimately it's good, besides it being a form of exercise, it's also good for your mental health, right? And that, like, when your couple feels good and you feel like you're on a good path, you feel good. Like, just look at what happens after sex, that all those hormones that are released, it helps with pain reduction. Why do they tell you if you have a headache, have sex? Sex, gets rid of headaches. Doesn't cause headaches. It gets rid of headaches, for the most part, except for a few people that get headaches from sex. But aside from that, it actually is the cure for pain. It's a great cure for menstrual cramps. The orgasm is very beneficial for all kinds of things. So there's only good reasons for it. And then the other part of it too is, like, okay, maybe you don't have much desire, but you can still experience pleasure. So why deny oneself pleasure? It's, I don't care how old you are. You could be 90, your clitoris still works, like your parts still work. You can still get pleasure. So we just have to get the message out there, which is one of the reasons I wrote that book, because I was getting older and I was like, all my friends are getting older. And I said, I'll be damned if we have to give it all up. And because I was hearing from people, I'm 60 years old, it's over, my sex life's done, who cares? It's like, no, it doesn't have to be, wait,
So is it a myth? I don't remember where I heard this, but that women's sex drive actually increases as they get older and men's decreases, or is that not true?
Sometimes that happens, but what you're hearing is the myth about women peak past 40, right? And like, it's the age, the peak sexuality. So what's interesting is the peak is the same for men and women. If you talk about hormones, we all peak around the same time when it comes to testosterone in our bodies or whatever. The difference is that women become much more comfortable with their sexuality as they get older. And when they're more comfortable and more open, it's like, I'm going to do what I want. This is how you're going to touch me. I'm going to, I'm not doing this just for you. I'm doing it for me too. So we kind of get rid of some of that baggage. And this is why, if you look on, one of the most popular porn searches is MILF. I don't know if you know what that is. Mothers to F. And why? Because this experienced past 40 woman is the one that has the confidence to say what she wants and to ask for what she wants and caring less about what people think and what have you. And I see this as women get even older, right? I talk to women in their 50s who are more sexual than ever and feel way comfortable, even though their boobs are hanging and they're wrinkled and saggy. They don't care. It has nothing to do with how sexual you are. It's not like, they are more confident with themselves. And the 50 plus women who I know who have been single and dating will tell me, it's like, guys don't care about if your nipples hang down or straight up. They really don't. This is not, they just want skin. Like, they're okay. They just like naked. It's all good. And this was a big realization for a lot of women, to increase their confidence, especially ones that were getting divorced or what have you, that were feeling like they were competing with young women. But it's not what men are looking for. The older men are looking for women their age. They're not, you have some obviously that are going for the younger, but by and large, that's not what's happening. So that's a myth too, right? Because a lot of women are like, oh, I'm not going to bother. Men only want young chicks. Well, no, that's not the case.
I love this. It's like empowering women. And I love that you said, like, confidence, just confidence in themselves, confidence in their body, regardless of what it looks like at what age. They know what they want and they can ask for it.
Yeah.
So
exactly.
I think that's great. So one question we have for you, as we're in year 2 of the pandemic and people are working from home and they're spending so much time together, and then kids are home all the time, or you have like older teens who are around. How do you freaking find time or space to fit it in? It gets complicated. And as Marnie said, we have teenagers and well, either they're gone all the time or they're home all the time. So,
yeah, exactly. Well, listen, I think we have to accept that we have a reality here. This is the reality. We know that too much togetherness can breed contempt. Like, get out of my face. Like, I've seen enough of you. I don't want to, so part of that is, giving each other space, even in a home, if you can, like, give each other some space. Doing activities outside the house, as limited as they are today, but whatever it is, go for a drive, do something that is just the two of you, that gets you out of your routine. I think, find a lot of people are uncomfortable having sex if their kids' rooms are right next door. I don't know, go in the shower, like take a bath, go in the shower, take a shower together, lock the door, like find the places you can lock up and your kids will leave you alone, like you got to get a bit creative in that sense. And you also have to give each other a bit of a pass. It's like, look, this is not what I want, not what you want, but this is the reality. And let's just get through this and we'll be okay. Let's not we'll be okay. So we'll adapt to whatever we can do. So you can just get a bit more creative, and it may not be exactly what you want and may not be what you had before, but none of us are in a position of what we had before. So life has changed a lot, and we've got a lot of people experiencing anxiety for the first time, and it's just, stresses they never had before. And so I think we need a bit of compassion, and the more compassion you have, compassion leads to passion. I can tell you that. So you feel like your partner's compassionate with you and you're compassionate with your partner, that goes a long way.
I love that. And, something that you said earlier reminded me of just the 4 love languages. And so trying to prep and, before you get in the bedroom, if you will, creating that environment and the relationship between the couple. And that's kind of what you're saying here now, do things that, make your partner happy, fill them up, bring them joy. And that will just hopefully help when maybe you don't have the time, but also when then you're in the moment, you're both ready and you're excited about it.
Right. And imagine 2 people thinking the same thing, right? I want to bring you joy. I want your happiness and you want my happiness. Well, then in that way, we make things work rather than pressuring each other. You're not giving me enough. You're not doing enough. You're not this enough. You're not that enough. When that happens, the other person pulls away. They're not likely to go to do more. They're likely to have sex with you out of obligation and a chore just to shut you up. Is that what you really want? Do we want that? We don't want that. And I know men don't want that either. They want you to want it, and they want you to be there because you want to be there. Ultimately, if not, they're jerks. So, but ultimately, most guys are pretty good guys. That's not, they want you to enjoy it.
Absolutely. I love that. I totally agree with that as well.
You said something about love languages. I would just want to go back to that because that's been on a lot of people's radar. A lot of people are reading, and there's those tests online and whatever. And I do love understanding what our love languages are, but there's something important here. And people don't understand. They say, well, that's how I show you love. So that's my love language. But it's more important to know what your partner's love language is and respond in their language. It's not about your language. It's about their language. So if your language is acts of service and your partner's language is affection, you have to become more affectionate for your partner. Even if it doesn't come naturally to you, you have to put the effort in because that's his language and vice versa. So it's good to understand our love language, but it's even more important to understand our partner's love language and respond in that way. That's what's useful in that whole thing.
Absolutely. I'm glad you clarified that.
Yeah. And would you say it's important for you to let your partner know what your love language is as well?
Absolutely. Absolutely. And yes, because your partner's going to act in their love language and say, well, what do you mean? Of course I show you I love you. I bring you coffee every morning. Yeah. Or I buy you flowers every week. It's like, I hate flowers. Right. I really don't care about flowers. That's what's in your head. So this is what would matter to me. This is what it looks like to me. This is what feeling loved looks like to me. And then when you break it down in terms of what it looks like to you, now they have a better understanding and they have a menu from which to pull. You can't just tell somebody, I need you to be more romantic. Well, maybe their idea of romance is bringing you flowers and buying you chocolate, but your idea is rubbing my feet or making dinner. So you have to say, I want you to be more romantic, but here's what it looks like to me. And you make a list and you give that list to your partner.
I love that idea. That's a great idea. So what would you say for women that feel really intimidated by this conversation? I think Stephanie and I are both pretty open, comfortable people, but I know a lot of women that would be very uncomfortable even listening to this conversation. So how would you...
Did we say anything that drastic?
No, but I think there are a lot of people that feel, I don't know if the word is repressed or, like they were raised in a certain way and this just makes them uncomfortable.
Okay, but do you know the expression life begins at the end of your comfort zone?
Of course.
Okay. So here's where you have to get uncomfortable. So yes, sometimes learning new things. Yes, this show might make you blush. Yes, hearing me, you might cringe at some of the things that I'm saying. And you might think, oh, how could she say that? Or, whatever it is. But like the more you listen and the more you understand that this is a natural part of all of us, it's okay to talk about it. We're not anomalies, the three of us just talking about this. We're here because we want to help people have more fulfilling lives. Sexuality is part of that fulfillment. So get past your discomfort. Once you start hearing this podcast, maybe tune into my podcast, maybe tune into others that talk about sexuality, suddenly you become less, embarrassed by the talk. And that's how it starts. Nobody's telling you go out and do this or do that. All we're just saying is just listen. Keep an open mind. Just listen a little bit. Take what you want out of it. You may not want to apply all of this today, and that's perfectly okay. I respect where people are at, and we all have a journey, and however that journey goes,
That's such great advice. And one, I love your podcast because you have very specific topics, so people can go on there, and we'll link it all up in the show notes if there's one, specific question or issue that they have. So and just understanding that this is part of life. This is part of why we're here on earth. And so it's normal and it's healthy, and just listening, I think, will help probably break down those barriers and get people to step out of their comfort zone.
And people do, when I did my radio show for so many years, it was on a very conservative radio station, by the way. So I never thought it would last more than 3 months. Like I was like, 22 years later, I'm like, whoa. And which tells me that I underestimate our population too, right? So people may not necessarily feel comfortable themselves talking about it, but they're more than happy to get informed. And I've talked to many different age groups, and older people are very interested in hearing about sexuality. They show great interest in it, even though you don't know it just by, your everyday talks with them. So, but I got to see that, just by the sheer numbers of people who were tuning in on a nightly basis, and the feedback that I got of things that we never thought it would last. We thought we'd get booted out of there real quick, because our topics were pretty, we didn't shy away from anything. But look, that we did what the people wanted, and the people wanted sex talk.
Yeah. So, and I'm sure that's true, actually, it's almost like the more taboo or whatever it is, the more people are curious, right, to hear about it.
Yes, and hearing it from not a place of sensationalism, but a place of professionalism, where, of course, it can obviously have to be entertaining as well. But there is the professional side of it and the evidence side of it. All of that brings a bit of a different perspective to it. It's not shock value here. This is real life what we're talking about.
Yeah. I wish I would have been listening to your show versus I used to listen to Howard Stern, and nothing against him at all, but I spent years on my commute to work listening to him for a long time.
Yeah. Right? The shocker. Yeah.
Yeah. Oh, anyway, Dr. Laurie. So as we start to wrap up the conversation, we love leaving our listeners with some practical and simple tips. And you've already peppered in so much to this conversation. But if there was just like one or two things that people could do this week, to
put sex on the menu.
Yeah.
Like I want you to think about it. I want you to plan, think about it in terms of like, how long does it actually take? Is 20 minutes, 20 minutes out of your day, like put an effort into it. We're not asking for you to hang off the chandeliers here and spend 3 hours of your day. It's 20 minutes where you get pleasure, 20 minutes where you get to relax, 20 minutes where you can ask for what you want, and 20 minutes where you can feel close to your partner.
Or if you don't have a partner, with yourself, right?
With yourself, yes. Exactly. So that's 20 minutes in 1 week. Please don't tell me you can't find it. I need, put that as that is your challenge for this week.
I love that. Great challenge for everybody listening to this podcast.
Yeah.
So where can people find you?
So, a little bit all over the place, but the easiest place, I suppose, is my website, which is drlaurie.com. It's drlaurie.com. If you go on YouTube and you just, put my name up there, you'll see my couple of TED Talks that I did on the subject of sexuality, mostly female sexuality and long-term relationships. My book, The Sex Bible for People Over 50, is available on Amazon. The podcast is called Passion with Dr. Laurie, which is available on all podcast platforms. You can find me on social media. My last name is spelled Betito. So if you look up at Dr. Laurie Betito, you will find me on all social media platforms as well. And you want to send me questions, sexual questions, whatever, we answer them on every podcast. We answer questions, listener questions. And so I'm more than happy to help out.
And we'll link all of that up. Sorry. We'll link all of that up in the show notes, I was going to say.
No, I was just thinking, the book that you mentioned, and I saw that you had written that book, and I was like, I'm like, well, I'm going to a 50th birthday party tomorrow for a girlfriend. Is that appropriate?
That's a great gift. A lot of people have gotten that gift. In fact, I have a cousin who somebody got it for her, unknowing that she was my cousin. She looked at the bush, oh my God. It was hysterical. So it was really fun.
That's really funny.
Yes, it becomes
very funny.
50-year-old.
Yeah. You could put it together with a whole bunch of things, the candle and all that, bunch of fun stuff,
toy.
Right? A sex toy. Exactly.
I love it.
Oh my God.
So as we wrap up this conversation, one question we like to ask all of our guests is, what does the art of living well mean to you?
To me, it means living a balanced life and a lot of self-care. It's doing something you love to do. So for me, it's working in an area that I love, but also being able to have other interests, a balance with family life, marital life, and my own life. So having my own life matters, meaning I'm an artist outside of this. I go out with girlfriends, I do sports activities, I box, I do different things. And then I, balance that out with couple time and what have you. So for me, it's about finding that balance. Can't work all the time. You need that downtime, making sure there's room for that. The same way you make sure there's room for your couple, you have to make sure there's room for me time. And to me, that's living well, but the attitude is the most important. So going into, having an attitude where, look, I will worry about the things I can control and not worry about the things I can't control. So the things I can control, fine. I'm solution focused. I'll find a way, and just have more of a positive outlook. And I think that makes a huge difference. It reduces stress a lot when the attitude you bring to the table is more positive, but that's a practice. Being positive, being negative is natural to us. This is built into our, system here. So being positive takes work. So work on that. Like I challenge you too, to start thinking in a more positive way.
I love that.
Love that. Beautiful. Thank you so much. This has been such a fun conversation, and one we know is going to be so, it's going to resonate with all of our listeners and really be educational and enlightening. And help them
exciting,
achieve
maybe
balance. Yes, exactly. Yeah.
Well,
it'll help them find their art of living well. Let's put it that way.
Nice. That would be nice. My pleasure.
All right. Have a great day.
Have a great day.
You too.
Bye.
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 Thank you so much for listening to the Art of Living Well podcast. We are so grateful that you joined us today.
If you enjoyed this episode, please share it with a friend or anyone else you think may benefit from this information. We'd love for you to subscribe to our podcast, leave us a review, and tag the Art of Living Well podcast on social media.
If you want more inspiration in between episodes, you can find us on social media at theartofliving_well on Instagram and Facebook, where we will share snippets from our daily lives and our journey to living well.